and then and then you come back.
Okay.
So we're live now. Am I seeing this correct?
Yes.
Okay.
Yes, we are live. So hello everyone and welcome to our last event for the Shame Shouldn't Be a Symptom exhibition. After we had 2 artist talk and 1 performance, today we have a therapy talk with our guest Daniela Kammerer. Daniela, welcome.
Hello, thanks.
And thank you for being here. I would just mention in the beginning we are having a bit connection issues, so I apologize for the delay on both sides, and hopefully it will be watchable for everyone. Our exhibition ends today. We have a finissage, so hopefully most of you watching are already at the gallery space. And to introduce our today's guest, Daniela Kammerer is working and living as a psychoanalyst in Vienna. She was recently working on questions of authority in psychoanalytic methods and how these theories constitute a psychic inside and outside. Her ongoing interest concerns structural psychoanalysis brought together with queer feminist thoughts. So again, Daniela, thank you for being with us today and finding time in your very busy schedule.
Thanks for the invitation. I'm happy to be here.
We are happy to have you, and hopefully we will be able to talk despite today's very tricky internet. So maybe you could I will just mention again about our exhibition that is a collaboration with the Foundation Made of Millions, and this year's topic is as mentioned in the title, shame, in the terms that shame shouldn't be a symptom of mental health issues. And it's our contribution to the Mental Health Awareness Month. And this whole time of the exhibition, we are talking about feelings of shame and how we should not be ashamed of experiencing mental health issues. And today we will be talking with Daniela about a less artistic but more professional aspect of mental health issues and treatment and institutions in Vienna specifically, and also shame from the psychoanalytic point of view. So maybe in the beginning, Danielle, could you tell us maybe a little bit more about the psychoanalysis itself, and what methods are you using in your practice, and maybe what is the main difference between what you as a psychoanalyst do and some other types of mental health professionals like psychologists and psychiatrists?
Spontaneously, I would say that the main difference is that we psychoanalysts work with the unconscious. This is a term not invented by Freud, but it's a term which was constructed by Freud. He gave it a theory, let's say. And that is a huge difference to other forms of psychotherapy. There are other forms which came out of psychoanalysis as well, especially Individualpsychologie in German. This is from Alfred Adler. He was a scholar from Freud, as well as T.G. Jung. He was also a scholar from Freud, and he also made his specific method, and those are also working with the unconscious. So I would say, but still it's not psychoanalysis in that sense. So I would say that is a huge difference. In German we say there's Tiefenpsychologie, so it means psychology, depth psychology, or the other humanistic therapy forms. So I would say that is a huge theoretical difference. Other differences are, and this is a main one in the psychoanalytic practice, that we psychoanalysts work also with the couch in this very classical sense as we know it from Freud. He is sitting behind the couch. I'm just looking at my chair behind the couch and the couch now in my therapy room. So this is really a treatment we offer. Apart from this face-to-face setting, which we also offer in our clinical practice. And the pros about this this setting of the couch is that you kind of get deeper into the into your own psyche, into your thoughts, into your into your thoughts in general and your fantasies, and you're not so much, you know, taken out of the concept because of the visual aspect, which is a thing, of course, in the face-to-face setting. So there's a difference, and we work usually when you're on the couch, then you come most of the time 3 to 4 times a week. And this is a unique thing that psychoanalysis offers, that you're working high frequently every week. So it's a very intense process.
And like, is it suitable also for like people experiencing like acute symptoms, or is it more something that a person should incorporate into their lives to like change the quality of the like day-to-day lifestyle, or is it like really also like could be helpful at least as an addition to like psychiatry help or psychology, like as an after like the person was diagnosed, let's say?
Well, I'm a psychoanalyst, so of course I will say that it's very useful to do psychoanalysis. I really stand behind my method, and of course you get that to hear from me. But it's, you know, if someone is suffering very acute and very severely in a particular sense, then you don't have to start with the couch. A possibility is always to work face-to-face once a week, so it doesn't get so deep in the beginning. So you're working much more on stabilizing the person, and then with the time, it's possible to start psychoanalysis or keep up the treatment once a week. Or in other ways, it depends on, of course, the person, the problem they're having, the suffering they're having, also the financial situation, time, resources, etc., etc. So there's a lot of elements coming into play. But it's, of course, also a possibility, if there is a severe suffering, to start with psychoanalysis right away. And at the beginning, you know, it's maybe the treatment. I have to say, I sometimes, and that's very known in psychoanalysis, sometimes people are coming to me for half a year, for a year, or even longer. And then after a long time, you get the sense now the therapy has started. Everything we were doing before was working on different elements so that the therapy can start. And this is totally okay. Everything is fine, you know? So yeah, it's every therapy is different in that sense. So I would say if one has an acute symptom or acute suffering, which is very intense, of course, it's always good to start therapy.
So what would you say, like what part should this psychoanalysis play within this whole like mental health treatment framework? Like for example, if a person starts to experience some kind of like anxiety, for example, or depression, or basically just any kind of symptoms that would be like at least diagnosed first as a mental health issue instead of like a physical body issue, like what is the like when should person like go to you, or to like rather go, because like is it even common to like after you get diagnosed by a doctor with some like symptoms, like a general doctor, let's say, to get recommended to a psychoanalyst instead of psychiatrist?
That depends on the doctor you're seeing. It's very individual how the doctor thinks about psychiatry, psychology, psychoanalysis, psychotherapy. So that really depends. There's no one answer to that. All I can say from my experience is that I have a lot of doctors who see that the issue the person is having is a mental health issue, and usually doctors suggest to go to a psychiatrist because, of course, you know, that's also a medical, that's also a doctor. So that's maybe also a reason why it's the first why this is the first thought, and then afterwards or additionally psychotherapy or psychoanalysis is recommended. And I know a lot of psychiatrists who recommend psychoanalysis especially, and there's also a good reason for that, because there's also a lot of publications and research concerning the development of mental health. If you're in psychoanalysis, and you know the results are quite good, especially if you have a severe problem, psychoanalysis can help way better than other methods can. And the reason for that is, as I think, and also researchers think, is that people are coming much more frequent. So, you know, if you're coming 3 times or 4 times a week, of course, the process you're in is much more intense, and that also brings a lot of possibilities. Yeah, that's what's working.
And in these terms, if like, is there some kind of a negative impact on the process of psychoanalysis when a person is, for example, using a medication prescribed by a psychiatrist? Like, there are like meds to suppress the symptoms or to alter certain states the person is experiencing that we call the symptoms of an illness, and therefore want to like get rid of them, basically. Does it then somehow like maybe suppressed, because when you work with the like unconscious, then is maybe the access to this layer of a person's mind.
That's not so much my experience, that with medication you kind of can get rid of the unconscious. Actually, you can never get rid of the unconscious. It's always there, whether you're feeling good or not good. The unconscious is there anyway. So you can't get rid of that in that sense. It's actually much more of a question of the I, the ego. In German we say the Ich, you know. Freud has this structural topic of the superego, das Über-Ich, the ego, das Ich, and the unconscious, das Unbewusste. And I think the question you're having when we're talking about suffering, it's not so much a suffering of the unconscious, it's a suffering of the ego. So you feel that very spontaneously, you know, if you wake up in the morning and you don't feel good, or if something happens to you, you feel it with your spontaneous, how do you say, spontaneous ego. You don't feel your unconscious that way, in that sense. So the thing is, if you're taking medicine because you have, for example, depression, then this can be good for psychoanalysis, because you can start to work, or you can even work better because the suffering is not so severe. Or it can be bad, because the suffering at the same time can also be, or in most of the cases, is a motor to do something about it. You know, it's your suffering is telling you that something is wrong, or something isn't thought through, and that you have questions which are not answered. And so this suffering is also kind of the best motto we have in psychoanalysis. So someone starts the treatment. I read recently from a psychoanalyst that every psychotherapy or every psychoanalysis starts with a I don't know what the word, with a Scheitern. Scheitern is, you know, you can't make it anymore. So usually we see that as an end in everyday life, as an end, you know, you can't do it anymore. But paradoxically, this is the start of a psychoanalytic journey.
Yeah, yes, thank you. Exactly, this is something that I would like to talk more about with you now, because this, like your answer touched this issue of how we as a society function and how we perceive illnesses, and what does health and what does illness like basically means. That that is then reflected in the treatment. That usually also many times the professional help is focused on just suppressing the symptoms, whether like mental or physical, just to keep us functioning in the same way that brought us to that illness. And basically like ignoring this thing. So what is maybe like from your like psychoanalytic point of view on this like societal approach, like what does it even say about us, and maybe how to like how to go to this therapy as a whole society?
It's an interesting question, because I think that psychoanalysis especially is very anti-capitalistic and kind of still revolutionary in that sense, even though on the other hand that doesn't that's not right at all, because our health system in Austria at least doesn't provide so much psychotherapy, especially not so much psychoanalysis for treatment. So the health institutions don't rely on psychoanalysis that much, which is a pity, because it would be better for society also, and this is now the paradox thing to say, that also in an economical sense, you know, so the interest of the state. In the interest of the state, it would be better to put more money in psychoanalysis or psychotherapy in general. But from this other point of view, where it's what I said, where it's getting paradoxical, it's very anti-capitalistic, because you know, it's not really, psychoanalysis takes a long time. We don't say when you're out of psychoanalysis, you will be the perfect person, you're free of problems, everything will be solid and even and super. So those are promises psychoanalysis would never make. What's also not, and let's say those promises would be like, you know, capitalistic wonderland somehow. We're always getting better, faster, higher, everything like that. And this is not at all psychoanalysis. We're dealing with conflicts and also with staying with the conflict, you know. So there are no huge promises made. And at the same time, what I said, it's like this kind of revolutionary aspect is in our today's society is that you're making something where you don't know what comes out of it. You don't know how long it takes, and no one tells you that yeah, you're gonna be the best version of yourself afterwards. So this for me in our today's society seems already to be something a bit revolutionary, to be honest. Yeah. So no false promises are made here.
Yeah, that's very nice. I think it would all help us, this like more realistic approach. But this is also what I meant. Like if maybe the first step should be to rethink this whole concept of illness, which is very different, like from some more like Eastern civilizations, for example, or like there are, you know, like this is very like a Western approach of like something is wrong, so we just have to like get rid of it and keep going, and that everything that is like getting out of the norm, which like the whole concept of the like normal is interesting in itself, but there's like anything that like deviates from it needs to be just like suppressed back into this
the norm.
this shape.
Exactly. Yeah, I would say that psychoanalysis is not interested in norms. I would even say at all, because an example, for example, is the classification systems we're dealing with in our clinical work. To work in this health system, you have to know the current diagnosis systems, of course, which is the ICD-10 from the WHO. We all know, at least now from the pandemic, the WHO, because the World Health Organization, because they always inform us about corona and new vaccinations, etc., etc. So yeah, and the WHO brings out every few years. So we're waiting for the ICD-11 International System of Classification of Diseases. We're waiting for that now for ages, over 10 years now, but it will come in the next years. And this system, you have to work with that as a clinician. But at the same time, we're not, in psychoanalysis, we're not so much focused on that, because it's a very unipolar, you know, a very one-dimensional way of thinking about psychic symptoms. It's really just from what you can see that is described in here. And in psychoanalysis, I would say we're used to thinking a bit more multidimensional and a bit more complex, maybe even. So we usually say in psychoanalysis that this is something we have to work with, but we're not really interested in. You know, it's nothing we can really use. And psychiatrists, also a friend of mine who's a psychiatrist, and he always wants to talk with me about diseases, you know, the ICD diseases, and this is everything he wants to talk about. And I'm always like, what are we talking about here? You know, I don't know anything of the person yet, and I just know a symptom. So this is, of course, nothing, you know, or a syndrome, and also a syndrome is not a lot. So yeah, this, I would really say that psychoanalysis is a bit outside of these normative thought systems. Because with, for example, depression, you can't really, you don't have an idea of the person. You just know one thing about this person. This person is suffering at the moment, but it could be because of an acute constellation in the life. It could be because the person, you know, has severe problems from age 4 on. And it could be whatever, you know. So this is something which you can't really express by a normative symptom. It's something where you have to see it in the individualistic dimension.
And yeah, and this is exactly what I found that sometimes more traditional forms of psychiatry and psychology treatment lacks.
Mm-hmm.
And it is more focused about is just like really getting person out of depression, but not thinking about why the person got depressed in the first
Yeah.
place. Because we just define that depression and these feelings are just like something wrong, bad, and person shouldn't be experiencing it.
Mm-hmm.
And so we just like try to get rid of it. So like if somebody wants to actually like go deeper, then I guess psychoanalysis would be the way to go.
Yeah, what you're saying is a plaidoyer to psychoanalysis. You know, you're really making advertisement here for psychoanalysis if you're saying that, because it's also from my point of view it's true. You know, a person is a very complex building, psychological building, and as I said before, depression doesn't say anything about this person. It's just one aspect, and we haven't understood anything. So you can't really, you also can't find a method to treat a depression. There's also no way, because you have to see on the individualistic level what's going on there. Even though, of course, at the same time, we can say, okay, there's this X of self-esteem. You know, something with self-esteem is working here, and we don't know yet why the self-esteem is, or why this X of narcissism is not so steady or not so satisfied, but still we know too little to have a clear or one and only method to treat that symptom. Yeah.
Yeah, maybe that's the idea, to treat a person instead of the symptom. And I think like sometimes this, I mean, it is a problem of a system, of course, which I think we won't have a chance to like get so deep into. But as we have this topic of shame, what is the psychoanalyst view on the feelings of shame, and also on this like from more general, like a broader point of view, why do we shame mental health symptoms so much?
Mm-hmm. It's also a huge question. And I think part of why we shame mental health so much is because, you know, at least, let's say, normative people, people who maybe didn't work through personal issues yet, and only constitute themselves as being sane, healthy, without problems. Then of course, if you have such an understanding of yourself, the problem is always on the other side. So there's no other way than to project those conflicts within yourself, which is human. You know, everyone has conflicts, and but if you have this feeling that of yourself, that you're this sane island, then of course the problem is always outside. So I think that is a reason why we shame mental health so much, because the relationship you have towards the outside and towards other people is always the relationship you have towards yourself. So inside is outside, let's say. And I think that is a huge aspect. So if I fight the conflicts in you and say, okay, this is your problem and everything, I constitute myself in this sane way, which is not sane at all if you look at it from an outside perspective. But yeah, as an individualistic point of view, it makes sense. So I think that is a reason. But the psychoanalytic point of view on shame, actually, as far as I know, not a lot. I'm sure something has been written about shame, but not a lot has been written about shame. And even though, of course, every like Freud and Lacan and Melanie Klein and so on, shame is mentioned, but it's not a really central feeling. And I think part of that is because the people we're seeing in our clinician practice are the people who kind of overcame this shame. So they can be sure that we as clinicians have a very relaxed notion of disorder. You know, we're dealing with that every day, so it's not a shameful thing for us as clinicians. Of course, it's like our daily bread, and we also learned it to accept it within ourselves. I think this is also an important aspect, and so yeah, I think that is why maybe psychoanalysts don't think so much about shame, because the ones who come into our practice already overcame that feeling of feeling ashamed for certain symptoms they have.
So I don't know, is there something like we could mention about how to maybe overcome that shame in an attempt to seek help, whether a psychoanalysis or like visit psychiatrist or psychologist, or like just to seek a help in general? Because isn't it like this, as you also already mentioned, just like this shame for experiencing something out of the norm, but like how to maybe broaden it up?
I think one way, and this is something I already mentioned, is that psychoanalysis kind of teaches us, and this is against the neurotic fantasy. And just as a side note, for Lacan, for example, and I really like Jean-Jacques Lacan a lot. He's also super problematic, but I also like his theory. And Lacan is making very clear that there is no way out of a neurotic symptom. In that sense, that sounds a bit weird when I say it like this. But for him, there are three realms. There are whether you're a psychotic structured person, or a perverse structured person, or you're a neurotic structured person. So there's no health in that sense. For Lacan, the identification with your symptom is the best thing you can do. So that is the healthiest thing you can do, identify with it. Of course, not in that sense. I don't know, I have a depression and I'm depressed, and this is the best form of living. But in that sense of accepting it and feeling okay with that over time. So I think this. So you can't really come out of neurosis, you know, you will always stick within it. That's and it's not just you or me, it's everybody. There's just no way out. So I think this point of view is really healthy. And I think this point of view is also deconstructing the fantasy, especially neurotic people usually have, that the grass is always greener on the other side. That you know, I have this a lot in my daily practice, that people of course always have the feeling that they're the ones who have the problems, but there are these other people who don't have problems at all. So this is a fantasy which sticks to a huge amount of people. And I think once you understood that a bit better, that conflict is nothing you can come out of. It can only get better, you know. you can alter the feelings of lust in your life. You can alter the feelings of pleasure. And that's it. And that's already a lot, you know? And yeah, I think this deconstructing of the myth that you're the only one who is in that position is already something which is more realistic and also works in counter. Do you say that in English? And also is the other side of shame about your symptoms, I'd say. Realizing that, yeah.
Mm-hmm. Yeah, so this is now contrary this commercial for awareness, because basically if everyone would just like honestly admit the honest like feelings they're experiencing, that just like in some kind of like a multiplied manner can be experienced as symptoms that needs the treatment, then it would, I think, would be more accessible to like go to the treatment. And so yeah, so we just all need to talk more about how we actually feel.
Yeah,
without
that's a good start.
Yeah, but maybe really if like can this concept of illness and of symptoms of mental illness is got in a way, because on one hand is good to be able to admit and acknowledge that this is something like out of norm in that way, that I deserve to feel better and I deserve to like seek the treatment to feel better, because this is getting like out of norm somehow of how I should be feeling. But at the same time, if we label everything as a symptoms of illnesses, maybe this is what is like standing in that way of why I don't want to like admit that I feel actually this way, because I don't want to be labeled as ill.
Yeah, I can only say yes to that. Yeah. I think this is the dynamic in the working dynamic of that. Yeah.
And like as we also like promised to talk more about like institutionalized help in Vienna specifically, what is your like experience with maybe some like institutions? Like are there some like systemic problems I believe are very like common, not only in Vienna but in general, and like what is maybe the main issue, or like maybe just not to be just a negative, like some positive highlights that you have like good experience with
Okay.
institutionalized help.
I'll try. I think in general it's a very good thing that especially the city of Vienna is really giving a lot or putting a lot of money in advice centers, Beratungsstellen, we say, especially in the healthcare system in Vienna. So sometimes it appears to me, if I have a certain problem here or there, there's always some advice center for it. And I think this is a very good thing. On the contrary, or the problem with advice centers is, or with the system, not advice centers, but the system supporting those advice centers, is that there's always too little money. You know, you can only come to a certain Beratungsstellen for 3, 4, maybe 5 times. I know some Beratungsstellen where you can come up to 10 times, and then it's already called therapy, and then there's no more money for it. So I think yeah, that I would say this is a problem, of course. I think in general, the most problem I see, but this is not just a Viennese problem, but a problem of the state, is that in Austria, psychotherapy is not so much valued in the health system, and this is really a problem. For example, in Germany, I have a lot of friends and or just acquaintances, and almost every person with whom I talk, this is just my experience, it may be, you know, more difficult, but still, with really almost every person I talked to from Germany, everybody said who was in therapy that the Krankenkasse paid for it, like 100%, and this was also for psychoanalysis 3 times a week. So I think that is a huge problem we have in Austria, that psychotherapy is not so much valued. And if it is valued, only in that sense that it has to go fast, you know, fast results. And fast results are okay. It can be what you need. It can be what you need. But also a lot of times it's what we already talked about earlier. It's only treating a symptom and not the structure, the psychical structure in general, not really giving the person space to make new experiences, especially in relationships, which is a part of a psychoanalytic process. So you don't give a lot of time for important integration, psychological integration that needs to take place. And I'd say this is the problem, you know, that the healthcare system doesn't really put enough money in it. And also we're not paid properly. Like if I have a free Kassenplatz, you know, if the Kasse pays for a patient like fully, which is almost never happening. Every psychoanalyst only has one full finance place, and then we also don't get a lot of money from it. And you know, it's also, of course, nothing I like about it. So in Germany, people, and I only know a bit of Germany or of the German system. In Germany, people are paid more properly. So psychoanalysts and psychotherapists are paid more. They also have to work more with the Krankenkasse, with the insurance, which I also think is a good thing. That, you know, you really have to write a little thesis on a patient. And I think that's good. I think it's good that, you know, the Krankenkasse wants something from the psychoanalyst or the therapist. I think it's also good because of quality checks. You know, you see if this is a capable psychotherapist, if the psychotherapist is reading, is in the literature, is thinking about the patients, or just seeing them and, you know, doing whatever, let's say. This is, yeah, to formulate it a bit harshly. So I think that is that for me is a huge problem we have here in Austria. And also, and of course, that the patients don't get fully refunded therapy easily. Yeah, I know one person in my current life who has a full paid Krankenkassenplatz.
And do you think this exactly this like systemic approach toward treating mental health is like tied to this stigma? Like, is it like when we speak about Germany, is it like less stigmatized mental health there, do you think, or is it like what is what might be the issue like for this difference?
I think politicians in Austria are also like not on the same page as politicians in Germany. I mean, you know, of course, in Germany there's the CDU and the kind of same Partei here in Austria in charge, the ÖVP at the moment, in coalition, as we know. But I think that to be maybe a bit blunt about that, that Austria is just a bit dumber about these things, and in general, I'd really say, yeah. I mean, Anschober, the last healthcare minister we had, he was really the first for a long time who was spending time with the Berufsverbände of psychoanalyticians in Austria, and now we get a bit, or the patients get a bit more refunded from the Krankenkasse. So yeah, I don't know if it's linked so much to stigma. I mean, of course, one can draw lines between that, but I just think that the politicians in Austria, or it appears to me that they're much more, how do you say, kurzsichtig. They only look a certain and not so long way. Yeah, I think that is the problem. That when you're much more oriented in, which is in Germany, of course, the same. So that's not an explanation for that. But in general, if you're oriented towards fast results and you just want the people to work fast and be a Arbeitskraft, then of course you don't want to spend money for them. You know, you're not interested in that. You just want them to. You don't care how they feel. You just want them to function somehow.
Yeah, so we are again where we started, which is like a systemic issue, and yeah, like talking about again about this, like maybe we just have like around 10 minutes. So I would like really like to touch your current research or like ongoing interest about this structural psychoanalysis brought together with queer feminist thoughts. Like, can you tell us a bit more about that? Like, what is maybe the difference from the traditional point of view, and like how differently does it shape your practice, or what even is your like a main focus point in this?
To give a shorter answer to that, usually I'm very interested in processes of self-constituting. So how does the subject constitute itself? Itself is already wrongly said in that sense, because there's no such way. You know, you can't constitute yourself out of yourself. You're always reliant on the structure you're living in, like language, certain also societal norms, of course the law, things like that. So these classical structures we live in. And so my interest is to not only look from the subject point of view towards these structures, but also to do it vice versa. So that is why feminism and queer theory and post-colonial theory, etc., are so interesting to me, because they're also talking about how these structures influence the subjects, but in a much more critical way, and not so much in a way where it's just a structure, deal with it, you know, subjektare, like that means, you know, what is the word? Yeah, subject yourself to the norms, you know. So I think this conversation between queer theory or feminist theory, post-colonial theory, in general, critical theory, and psychoanalysis is very interesting, because I think both fields can learn a lot from each other. And as we know from queer feminist and also post-colonial thoughts, just an example, Judith Butler, she's almost always talking about psychoanalysis, you know, about Lacan, about Kristeva, about Freud, about Melanie Klein. So like philosophy and structuralism and post-structuralism are very concerned with psychoanalysis, and sometimes, and that is a huge problem, I think, in psychoanalysis isn't interested in other fields, not really, you know, like self-sufficiently, self-centered and everything. So of course that is problematic, and that is something which needs to be more discussed with other fields. And yeah, my personal interest is in philosophy in general, and I think, yeah, queer theory is also or feminist theory is also part of that. Yeah, so that is, I'd say, my ongoing interest in the discussion of these two fields, because I also think that sometimes in queer theory there are certain thoughts which exclude the realm of the unconscious, for example. So I think it's very good if these two fields are thought together more more neatly, you know, if, yeah. If they're learning from each other.
And is this for you now, like currently on a level of like research, or is it something that you're already like focusing in your practice? Like,
I mean, I work with queer people. I work with everybody who comes in my praxis. I have the underline in on my homepage, den Unterstrich, and that tells queer people that this is a safe place for them, and that they can come here, and there's a consciousness about these themes. So I have a lot of queer people, but not only queer people in psychoanalysis or in psychotherapy. And and apart from that, so this is the clinical side. But apart from that, at the moment, on a personal level, I'm really interested in new materialism, which is also like part of queer theory and philosophy. And I don't know yet how I should think it together with psychoanalysis. I was thinking a lot about the materiality of what I'm doing in the practice, because it's a very sublime thing, my work, you know. We're always talking, and there's not a classical outcome like a artist has if they're working with certain matter. But I was thinking about that, like the things we're working on in psychoanalysis are very much like materiality, you know, like inscribings in thoughts, which is also just the other side, the mental of the biological. So that's something I'm personally interested in, but at the moment I'm not having this one research thing in my head. Projects.
Okay, thank you very much. Yeah, I also was asking about this, like, as you mentioned that you have it written like on your website. I like find this very important because let's be again honest, that sometimes the wrong therapist or the wrong therapy can harm even more.
Yeah.
And I think we will have to end now, but maybe we could finish with this like idea that that's why it's also very important to talk about it. So like in a more broader sense, and like as much people as possible, so then people know where to go for the right kind of help.
Yeah, something I'd like to add to that is if someone has a first session, you know, these Erstgespräche where you get to know the therapist and you're in a lot of suffering and you just want therapy and you have this feeling every therapy will work. It's really important to stick to your gut feeling. If you can sympathize with the person, if you like this person, if there is something you can grab onto where you think this could be a good room for you to work with the things, with your things. I think this is really important because, as you said before, if something about the connection is terribly not working because it's still two subjects meeting each other, and you know you can't get along with everyone, then it's really important to stick to your gut feeling, but at the same time be open to the therapist and honest about it. So yeah, and give them a chance to say something. Yeah, but I think that is very important what you said. Yeah.
Thank you very much, Daniela. Can we maybe just mention your website, or like where could people reach out to you, possibly, if somebody would be interested in getting to learn more about psychoanalysis or your current research?
Yeah, my website is psychotherapy-kammerer.net. So you'll find me easily on Google, Daniela Kammerer, psychotherapy Vienna maybe, and then you come to the site and there's my email or a contact formula, and also my phone number. So there are ways to reach out.
Amazing. Thank you very much again for talking to me and being part of our contribution to Mental Health Awareness Month. And hopefully more people will open up about their own experiences and symptoms. And at the end, I would just add a thank you very much everyone who was in any way part of our project. And now let's enjoy the finissage. And I would just point out that you can still access also the virtual part of the show, which is a selection with different artworks that are exhibited in the gallery. So you can find the links on Improper Walls Instagram and Facebook and website. So hopefully you enjoyed it.